Hi, everyone. Welcome. I'm Jessica, and I'm here with Dr. Marc Sklar. I'm the co-founder of Leiamoon and super excited to be here with you today. A bit of background on who we are. My husband, Andrew, and I founded Leiamoon about 2 summers ago now with the mission to empower the womb. And we've been doing this by creating content and spreading awareness about positive menstruation mindsets and feminine self-care practices, focusing specifically on vaginal steaming as it relates to women's health. So yes, vaginal steaming. Marc, I know you've had experience saying that phrase one time too many, or maybe.
Yep.
Yeah, it sounds totally strange, but it is a really valuable tool that's actually not some new bizarre trend. It's an ancient therapy traced to several different cultures spanning the globe, from South America to Korea, passed down for centuries, and is more recently gaining traction in modern culture as a viable treatment for a spectrum of women's health issues. So to help demystify vaginal steaming, I'm honored to be interviewing you, Marc, today, the fertility expert of the Reproductive Wellness Clinic in San Diego. Marc is a doctor of acupuncture, a board-certified herbalist, and an Oriental medicine practitioner whose amazing group is committed to helping couples achieve optimal health, equipping them with essential knowledge and support from a medically integrative perspective, as you put it. I also love your mission statement to help women believe in their fertility, to help them empower their body to create new life using natural techniques. So just those choice words behind that philosophy of believing, encouraging, empowering, and creating is really spectacular, just in terms of mindset with doctor-patient relationship. So I caught one of your first YouTube videos 3 years ago titled Vaginal Steam Baths for Reproductive Health. So I couldn't be more excited to be speaking with you about this particular topic. So hello, Marc, welcome.
Thanks for that beautiful introduction, and thanks for having me, and thanks for finding me 3 years ago and reaching out. It's an honor to be here, and it's a topic that I talk about often and love talking about and encouraging women to participate in. So thanks for having me. Yeah.
Sure. Yeah. And it seems that this practice is rising in popularity. And I use the word seems because I'm very careful to recognize that's probably how it looks from my perspective in my circles. But let's assume, rightfully so, that most people watching have never heard of vaginal steam baths before. Can you just tell us on a basic level what it is and how it's done?
Yeah, I mean, it's been, as you mentioned in the introduction, it's been done in many different cultures. And if we start to look at that, it's probably been done a little bit differently from culture to culture, using different herbs for what was available to them in those parts of the world. The way I like to incorporate it into our practice and recommend it to our patients is really done to cleanse the uterus, cleanse the vaginal area, the vaginal canal. I kind of refer to it as like a facial for your uterus or vagina, for all intents and purposes. And it's should be thought of as being cleansing, relaxing, nourishing, rejuvenating. And so that's really the mindset that I have, and why I encourage it. There's lots of different other things that go into it when it comes to fertility and reproductive health, but kind of in a simple framework, that's kind of why we use it and how we recommend it.
So then the process involves like sitting or squatting over a steaming bowl of water. Is that?
Yeah, yeah, essentially. Yeah, and so you'll there's a couple different ways to do it when it comes to the technical aspect of it, and I have some patients who prefer to put the herbs in the bowl and pour the hot water and just let it steep there, and I have others who prefer to steep it separately and then pour it into the bowl and transfer and so forth. It's really what's going to be easier and most useful for and more practical for the person doing it. In general, what we recommend is you boil hot water, you get your herbs, you take a scoop of it, you put it into a bowl, pour the hot water over it and let it steep for about 5 minutes. I like to cover it while it steeps to keep the heat in. So we do used to have a kind of kettle pot that also you can boil the water and the herbs all at the same time in the pot, which is also nice. So that's why I say there's all sorts of different ways to do that part of it. But in essence, you're taking that bowl of steeped herbs and you're putting it, now the chair part, which we discussed before we started the segment, is a whole other technical issue, but you get a open chair similar to like a toilet seat on top, and you put the herbs underneath, and you're disrobed from the waist down, and then you sit on top of the seat and let the steam come up. But the key here is that you want to be covered all the way around, right? So you've got to have either a big blanket or a big towel that drapes all the way around to the floor and covers so there's really no opening, so that the only place for the steam to go is up. And you sit on the chair and allow that to happen periodically. As the water cools down, you might have to refresh it with a little bit more warm water. And so that's something to be careful of. I also say the distance between the hot water, the steam, and your skin is also critical here. I've had someone, try to do it with a sitz bath basin on a toilet, and I think that's way too close, or you really can't use that hot water. I think that part of it is a little bit challenging, or can be. So you want to make sure that water is always fresh. And I usually encourage patients to sit there from anywhere from 15 to 30 minutes, depending on the time that they have, and to relax and either listen to a nice meditation, read a relaxing book. But this is time for you. It's not time to watch TV. It's not, although I'm sure people do that. It's not time to, be working. It's time to be with yourself, with your body, to connect with yourself and allow this to be a really relaxing process.
Mm-hmm. I'm glad you covered too distance from the steam, because a few of our Instagram followers are writing in wondering, how far is too far, how close is too close. But I think the main concern would be, don't burn yourself and use common sense as much as possible. But those are all different, really valuable ways of being able to do it at home, either with the sitz bath or kind of using the toilet bowl or a camping toilet we were talking about.
Yeah.
Stool, a lot of stools are out there for this specific purpose. So it seems to be there's a variety of tools available now for this practice, which is great. Another question that we get a lot is, does the steam actually go up through the vaginal canal, through the cervix, into the womb and uterus space? And that seems kind of up for debate. And I'm imagining it may depend on where the woman is at in her menstrual cycle or how her body is positioned. I'm curious if you kind of, sunk deep into the rabbit hole of analyzing all of those potential spaces the steam might be carrying to and what that might mean.
Yeah, I mean, I think it's hard to know for certain how far the steam goes. I feel pretty confident that the healing properties of the herbs and the steam with which it's carried definitely hits the external vaginal tissue. I think it, for me, would easily get into the vaginal canal and possibly even the cervix. How far it gets beyond that is really difficult to know. And like you said, I do think it depends on how open the cervix is. And so that would be based on kind of where a woman is in her cycle. That being said, if someone is trying to conceive, I only recommend doing this practice between menstruation and before trying. So I usually say, just to keep it simple, to ovulation. But if you're actively trying, right, before that, then we cut it off before that. So we don't want anything to interfere with the environment, with the natural process of sperm getting to the egg. And so if you're actively having intercourse for conception purposes, and typically it starts before ovulation, then, we would cut it off before then. So with that, when you look at timing and practicalities of it, you're really only able to get it in once, probably once, maybe twice in a very short period of time. If you're not trying, then we've got a whole month theoretically to do it, and I think it's totally fine to go at different times. And for that, then yes, I think doing it right at ovulation actually would make a lot of sense, because that's when the cervix is the most open, and so it has the most potential to get as far up into the uterus as possible. I also don't think it's a bad idea to do it just as you're tapering during menstruation, at the end of menstruation, to start that there as well, to help kind of facilitate that final process of cleaning out and emptying of the uterine tissue, the endometrial tissue and so forth. I think that's also a fine time to do it as well.
So not during menstruation, but you would say...
I don't like to recommend doing it during menstruation personally. I like to let the body do what it's supposed to do. Now, there's a lot of variables that come into play here, right? All sorts of different conditions, issues that potentially can arise, or someone might develop in the reproductive organs and pelvic area that may require a different protocol, different timing. But in general, I don't recommend doing it during menstruation, during the heavier days.
Right. And I guess intuitively it would make sense when your body is naturally going through the shedding process or the release of something that you wouldn't necessarily want to be kind of counteracting that by bringing something in.
And I don't think that I've ever seen... I haven't seen, if there is literature out there that shows that in different cultures they are doing it menstruation. I haven't seen it during menstruation. I haven't seen it. So
yeah, no, that makes sense. And even, I guess, in looking at the history of it or its roots in Eastern medicine, the real primary function of it, you were talking more about cleansing the uterus, but are there other reasons why women would do this, and why it might be better to do it at certain times of the month than others?
Well, certainly if women have certain conditions, let's say fibroids, cysts, endometriosis, things of that nature, some sort of blockage, then I do think it's, well, first I would say then if you're trying to conceive, you're taking a break during that time period, so that way you can give yourself the whole cycle to do it as many times as necessary. But then yes, for those conditions, you kind of want to take advantage of the process. I don't typically believe, and I haven't seen that just steaming on its own will be enough to make changes in these conditions that I mentioned. But I do think steaming in conjunction with other lifestyle changes, herbs, whatever we might incorporate into it, also makes can make a profound effect, or have a profound effect. Yeah.
Then what are those effects of the steam coupled with the herbs? But even if we were just to talk about steam alone, bringing heat, moist heat to this area of our bodies, what does that do on a physiological level?
Well, just like anything, when we think about heat is always going to be more opening, more moving. It increases more circulation, or cold constricts, right? So just the natural process of heat in general, first and foremost, is going to increase more blood circulation to that area. When we talk about moist heat, like we're doing here, then that brings more nourishment as well with that circulation. So I do think that combination is really important. In Chinese medicine, there's one of the therapies that we use quite often is called Moxibustion. Mm-hmm. And it's a similar process. I mean, people would say, well, what does burning this herb on top of the skin, how is that going to be therapeutic? What's that going to do, right? But there's thousands, maybe even tens or hundreds of thousands of research articles just on using this therapy for specific conditions. And it has been documented to have very therapeutic results beyond just increasing blood circulation. There are properties within the herbs that we're using, right? Not just for Moxibustion, but also absolutely here when we talk about steaming. And these properties are then, transmitted, if you will, right, through the steam. and through the heat and that moisture, and those properties in those herbs, depending on what herbs you're using, are going to have a therapeutic effect, depending on, again, what the therapy is or what you're trying to achieve. So I think it's hard for our Western logical mind, if you will, to grasp this and conceptualize this, and really understand this to be true. But I've seen it clinically, so I know repeatedly what the potential is and what can be possible. And I encourage those people who are questioning this or something similar to just let your rational mind step aside for a moment and, practice it for yourself. See how you feel. See what happens during the process for yourself.
Yeah, and I guess even as you mentioned earlier about the idea of making space for yourself to kind of relax into this practice and in a meditative way, and the benefits it can have, like on that more kind of psycho-spiritual level, are very deeply related, it seems, to the physiological benefits. And you're right, there is this tendency for us to want to kind of sink more into the rational mind and want to know like the science answers, and that those are going to be separate from the more kind of emotional body or spiritual answers. And I think what you're suggesting here is that we kind of need to stop making this a dichotomy and really think about this practice as an opportunity to kind of experience physiological benefits that might also help us cross over into the psycho-spiritual, emotional ones. And I think that plays a huge role in fertility, I'm sure, in your experience.
Yeah, absolutely. I think, it's not to say, and I'm a big fan of research and science, so, don't get me wrong in this, but I don't think it's everything, right? And I think it has its place. But there's a reason why something's been done in multiple cultures repeatedly over centuries and passed down from generation to generation, because it's been seen to have positive results. So, we might call it an old wives' tale, or whatever wording we want to use. I prefer to say it's something that, I like to trust intuition. I like to trust female intuition. I think it's a little bit more intuitive than male intuition for the most part. I'm making generalizations, but for the most part. And so with that, I have to trust that generations and generations and generations ago, when this was started, that they found something that was beneficial, both spiritually, and physically, that this was something that continued to be passed down from generation to generation within families, and then became more widely used. So there's definitely something for our Western mind when it comes to science, but I don't think that's the end all be all. And certainly science is, when it comes to research and steaming, there's a lot that can be done and maybe should be done moving forward, but really very little that has been done up until this point, when we start talking about like the real research and science behind it and what therapeutically it can achieve together, right? Looking at the cause and effect.
For sure. And even, I guess, in your own practice, do you have studies of where you can link steaming specifically to positive fertility results or helping to heal endometriosis or any other women's health issues?
No, I don't have a lot of research in that regard, because, like I said, there's really very little that I have found of good science, I should say. But I think that would be more valuable to me, or more important for me, if I saw, if that was the only therapy that I was using with patients. Mm-hmm. For me, this is just a piece of the puzzle. It's a piece I like and that I recommend often, just like other things, but it's not the only thing that I rely on. And sometimes it takes multiple pieces to finish that puzzle. And so, this is just one of those little pieces that go together.
Well, in what cases would you recommend this to your patients? Or is it you do, or is it specific instances where you're like, oh, I know what you need? Vaginal steaming.
Well, I do think that in general terms, if someone just wants to do something that feels nourishing and therapeutic and they're taking some time out for themselves, I don't think there's any harm in doing this, especially if you're just going to do it once a month. Now, I think with anything, as you know, people have potentially heard me say before, I have my mother whispering in my ear, everything in moderation. I do believe that as long as we do this sort of thing in moderation, and you're not doing it every day, then I think it's completely safe. But if you're going to be trying to do this every day, it's excessive, right? So now you're starting to get into a different territory where you're starting to potentially change environments, and that I don't condone. So I think just like with everything, there needs to be balance. And so if someone who came in and it wasn't at the top of my list of recommendations, I would still say, I think you can do this. I would just have you do it once a month because it helps to be cleansing for the uterus. It helps to bring more nourishment and circulation to the area. So I think you can do this. Now, there are specific conditions where anything that has any obstruction in the pelvic area, then I do potentially recommend it. So if someone comes in complaining of pain, pelvic pain or dysmenorrhea, I think of this in conjunction with other things. If someone has a history of endometriosis, blocked tubes, cysts, polyps, fibroids, things of that nature, then certainly this would be something I recommend.
That's great. And even just like I'm sure you get a lot of people coming to your office not knowing very much about the processes of their own body that happen involuntarily each month. They know they get a period and then they know now they want to get pregnant. But all the stuff in between has remained mysterious for most of our lives. And it is a great mystery, to just be fair, but I think so much of what you do must just be related to education and helping connect people to this part of their body so that they have a much deeper understanding of what's going on so that they can get to where they want to be, which I think is part of your kind of empowerment philosophy, like empowering your patients with the information and tools to really get to know themselves, to be able to speak with their body more directly and get those results. So I think steaming as a practice, in a sense, can help women communicate with that part of their bodies, kind of for the reasons you're saying, on a physiological basis, because it is a lot to do with opening and bringing the heat and increasing the circulation, but also just in developing that kind of mind-body awareness, like, oh, this is a space that I have here that's not, just for, I don't know, not just for making babies either. It's something that goes through this natural hormonal cycle every month and is certainly talking to us. So.
Oh, absolutely. I mean, I'm always amazed at the lack of education that women get about their bodies. All of us, men and women, but I primarily deal with a lot of women. So, but I'm always amazed at the lack of education that they get about their regular cycles, their hormonal rhythms, their uterus, and so much of what the culture is here in the West is very much about being here and not here, right? Not in our bodies, more in our brain. So everything's very logical. And very less so about what's going on, what do we feel, and what does that mean, right? And being in tune with our bodies. And for women, I think it's really important for you to be in tune with your body. It's something that if we just listen to what our body says to us, then I do think that we can learn a lot, and we might make different decisions as well. So the amount of education that I do with women on a regular basis is a lot. It's extreme, because of that lack of education that they get growing up. It's we don't have to go into the politics of it, but like, it's such a taboo topic to talk about sex and, breast health and uterine health and, what should I notice in vaginal changes and things of this nature. It's really not something that is communicated a lot, and the way it is communicated with or about in schools, even if they still do sex ed, which I'm not quite sure if they do, they talk about it as something, hey, we're going to talk about this, but we don't want you to talk about it again. And it's very, they make it to be embarrassing and not something to be honored and proud of, which I know is different in other cultures and other countries. And so I think this makes it more difficult for women in the West to understand their bodies and understand what's going on. And so just the subtle shifts, the subtle changes, the subtle signs, the subtle symptoms that change from week to week or day to day in a woman's cycle can be very empowering, because they give you so much information, right? And so this practice allows you to be more in tune with your body, allows you to understand your body a little bit more. I think it's extremely valuable, right? Oh, why am I having discharge now versus later? And why is the discharge changing? Oh, I did the steaming and my discharge improved or went away. These are all things that are very valuable pieces of information that I think we take for granted in many ways, and we just ignore.
For sure. And what about stress? Like, how does stress affect that cyclical nature or discharge, as you're explaining, or other pieces of women's reproductive health? I'm sure in fertility, like, that can be a really big signal of why things aren't going maybe as planned, because there's just so much distraction from the body being able to kind of relax into creation versus kind of guard up against it.
Yeah, I mean, stress, just like with any health issue, is something that definitely needs to be managed, discussed, and hopefully kicked to the curb if we can. But stress makes every health condition we have worse. And there are countless research articles that just show that. So if we can manage our stress, then that's, I think, a huge benefit to us. And if this is a means to do that, right, because it gives you time with yourself, even if it's just once a week or once a month, it's more than what you had before. Now, I do like to encourage more than that, but if this is one way you do that, and one way that you can gather yourself and be with yourself, be more in tune with yourself, you'll find that your stress levels go down. You'll find that you're more comfortable with listening to your body and more comfortable with listening to the world around you, that you might make different decisions. This goes hand in hand with that then.
Mm-hmm. And are the herbs that you'd prescribe alongside with steaming, or to steaming herbs, related to ones that promote relaxation and de-stressing? Or I'm sure there are also ones that are specific to the female reproductive system. I'm just curious to hear. I'm sure there are different herbs that give different.
Yeah. Well, part of it, for sure there are, right? All herbs do different things. There's my standard formula, which is what I use right now, and I am formulating different steaming formulas for different conditions currently. But my standard formula, if I'm not mistaken, is about 12 or 13 different herbs, and they each do different things. But part of the therapeutic nature is also, how do they smell, right? Like when we inhale it, how does that make us feel? Just like essential oils, essentially. So yes, I'm picking things for different reasons, but most of the herbs are, what effect is this going to have on the tissue, right? What effect is this going to have on the area? So like mugwort is one that I recommend in my blend, that I use in my blend. But that's also the main herb that is used in Moxibustion. Mm-hmm. I call it an herb. It's a weed. You can find it on the side of the road if you decide to harvest it. But mugwort has a lot of therapeutic actions in Chinese medicine. It's very healing, very tonifying and strengthening, but also very moving for increasing blood circulation and breaking blockages. So that's one of the reasons why I use mugwort a lot. But on the contrary, I have marshmallow in one of my in my blend, and that's very healing and very nurturing, right? So it's about finding the right formulation for for each condition, essentially, and kind of putting that together in the right way. But absolutely, smelling it is definitely one aspect of it, because that's going to help us relax, right?
Definitely. Do you find that there's a difference or a recommendation between using fresh herbs or dried herbs, or just where you're sourcing them, whether or not they're organic?
I mean, all of our herbs are sourced organically. And for me, that's always something that is very important. I think if you have a garden with these herbs, readily available, then sourcing them fresh and picking them and using them fresh like that, I think is awesome. I think most people practically just don't. And so, the next best thing would be, getting that dried herb, just like you would use it for a tea, you're just using for steaming.
I know some people ask about using essential oils with steaming, and from what I understand, that's just extremely strong, and the volatile oils are just really potent and not necessarily appropriate for this practice. So there are quite a big difference, I guess, in terms of potency from having kind of loose dried herbs versus using an oil.
I think so. I mean, well, one, essential oils have made a big push, if you will, in the last 10 years or so, and they're great, but they're strong, and they're processed and blended in a certain way to be very strong on purpose. Excuse me. I don't recommend using them for steaming. I think you want fresh herbs or dried herbs, because there's a process of the steeping of it also that breaks up the herb itself, that emits the properties, and the properties are different with oils. They're not exactly the same with an oil as they are with. I'm not an essential oil specialist, but they're, from my understanding and reading, it's not the same as using an herb.
Yeah, that makes sense.
Yeah.
And also, when you were mentioning mugwort, that's the herb that I constantly hear about when I think vaginal steaming. But I think in general, if you look at any like Korean medicine, it's used for a whole host of different things.
Well, yeah, it's big in Asian culture.
Mm-hmm.
Yeah.
But I also really appreciate its relationship to I think the other name for it is Artemisia.
Mm-hmm.
And that kind of bears a relationship to Artemis, the Greek god of the moon. And there's like all this symbolism packed behind it too, of its relationship to the moon and having this silvery underside of its leaf. And so how much of like the signature of the plant do you pick up on when you're prescribing that as your main vaginal steam herb?
I haven't thought of it in that way. I'd say that I like that sense of it, but that's not typically how I decide. I'm looking at, most herbs have multiple properties and actions, and so I'm looking at those as my primary means of picking it out. Although, but there's each herb also has a flavor and other qualities to it. It's not just about those properties, right? Some of them might be pungent and warm. And so all of those things are things that we have to take into account when we're looking at formulation, right? At least from my practice of Chinese medicine, we rarely use like one herb in anything. Very rarely. It's usually a blend, and it's about how the herbs, not just what those individual properties are on their own, but how do they work together with one another. And you have to take into account all of those things. Yeah.
I guess too, it's nice to know that compared to essential oils, the herbal actions are relatively subtle or somewhat tempered by the heat or the steam that's carrying the herb. There's a lot of concern that I read about just questions of, do the steaming cause yeast infections or really disrupt the microbiome of the vagina? And does this harm the beneficial bacteria in some way? So I'm curious if you have any ways of dispelling those types of thought trains that, seem to kind of bash vaginal steaming as a practice, and just if there are any real health risks concerning steaming that we should know about.
I mean, I've seen some of those concerns as well, and I don't really find them to be true. I think the biggest concern for me is burn, right? Like, how close to your skin are you putting it? So you can absolutely burn yourself with steam. So that's really my biggest concern with patients, and I always want everyone to be careful about that. That aside, I have never seen anyone who does it properly and does it the way I suggest. I've never seen it cause any negative effects in the vaginal area. I've never seen it cause yeast infections. Quite the contrary. Like, I recommend oregano oil, oregano as one of the herbs, and that has a very antibacterial, antifungal property to it, right? And so, I think it would actually benefit something like that, not cause something like that to happen. That on the flip side, like what I said before, is I think if someone does this excessively and does this daily, for instance, and I'm going, from one extreme to the other, obviously, but let's do that for the sake of the conversation, that I do think it can change things, right? Because you're influencing the environment regularly and not allowing the body to recover from that and balance that out. Then yes, I do think it can have adverse effects. I have yet to see anyone do anything like this. But I don't want to discount that and then have somebody just start to do it every day. But I haven't seen it in practice. I haven't seen anybody have any negative side effects from it. But, in terms of changing microbiome, I would say the same thing. Like, if you're going to have Burger King every day, then it's going to change the microbiome of your intestines, right? Okay, well, if you're going to do this every day, it's probably going to change the environment. But if you do it once a month, twice a month, maybe even 3 times a month, spaced out, then I don't think that it will have that sort of effect. And I've never seen that.
Yeah, no, that makes sense. And I think again, using your intuition for when it feels appropriate to do so, especially as like a cleansing or kind of releasing ritual, that it would make sense to do this after menstruation or even like the few days before menstruation to help encourage that flow. But to then do this like every day, I don't know. Personally, that's not been how I've been attracted to the practice.
No. And I've never seen anyone who said, "Oh, I want to do this daily. Can I do it daily?" Like, it's a process too, so it's not that easy or practical to do on a daily basis.
I guess other reasons why you wouldn't do this, I think well, obviously if you have an open wound or something that would get irritated externally, then avoid steaming.
Right.
Also, I've been reading that if you have an IUD, that it wouldn't really be a good idea to steam. But I think it depends on the material of the IUD. I've read some different things on that.
Yeah, I mean, it's not, an IUD and where its placement can definitely be affected by this. Sometimes I would imagine that it can be loosened. There's also all sorts of variables that I wouldn't do this with an IUD, or reasons why I wouldn't do this with an IUD. That being said, I don't typically have patients who have IUDs, so it's not something I'm thinking about often.
That's what I was going to mention, because I also I know that your focus is more on fertility and helping people get pregnant, so you're probably really dealing with people during a pretty specific life phase.
Mm-hmm.
And I get questions a lot too about, well, what if I had a hysterectomy or I've gone through menopause? Why would vaginal steaming be something that would benefit me or something I would want to do? But I think still, for the kind of mind-body connection that we spoke about earlier, that this could be a practice valuable to a woman throughout any life phase.
Yeah, and I think actually it'd be really valuable for a woman who's had a hysterectomy or is in menopause or post-menopause, because the tissue changes and the tissue becomes less elastic, and more dry, and intercourse becomes more uncomfortable. And so if you can revitalize the tissue, if you can bring more moisture and nourishment to the tissue and decrease pain during intercourse, I mean, I think everyone would want something like that, assuming that they're having regular intercourse. Then I see no reason why you wouldn't do this in those circumstances. I also think a time where it would be beneficial, certainly after the healing process and after you've done bleeding, but postpartum, right? Yeah. I think it's very healing. I often recommend it for patients postpartum. I just want them to be done bleeding, and so women can bleed for weeks postpartum. And so my only requirement is that you're pretty much done bleeding postpartum, and then I think it's really beneficial.
That's great.
Yeah.
Yeah, and like as this practice, I guess, gains popularity. I mean, you're someone that's been advocating for it for a long time, and I think someone kind of more well studied in Eastern medicine, that makes a lot of sense for your practice. But do you have any suggestions for what we can do as a community of people promoting this way of healing to help dispel, I guess, some of the negative talk around it?
You know, I don't really focus on the negative talk very much personally. There's always going to be negative talk about everything because there's negative people out there and they want to bash things. I don't focus on it. I just focus on the positive, and I think really just talking about the positive effects, and also being grounded and open to more research and more knowledge and information about it is also important, but really just focusing on the therapeutic nature of it and how it can be used properly, and then really working around that and creating the community of women who want to take time to promote, to heal themselves, to nurture themselves, and really promoting that aspect of things, I think, is really where the focus needs to be on personally.
Yeah, for sure. I mean, that's what we plan to do too, to focus more on the empowering, encouraging side of things than give too much time to the criticisms. But at the same time, I think it is important to kind of get those case studies better documented and
sure.
A good way of kind of backing up why this is such an awesome practice to keep on going, as it is, rooted in history. So.
Yeah, I mean, we need that. We need that information. But I think that information should be gathered because we find it important and valuable for the practice, and not to basically, combat those who don't believe in it, are negative. Yeah.
For sure. Well, thank you so much, Marc. Any other closing comments you'd like to share with us?
No, I just, if there were any comments from those watching more than anything, so we can answer their questions if they had any.
Here, let me share these with you. We have from Anna, sounds like steaming is tea for the V.
I like that.
Could you drink mugwort tea while steaming with mugwort?
Did someone ask that question?
I'm asking this.
Oh, you're asking that question.
Inspired by
we don't usually use mugwort in that way. Mugwort, I don't often use to ingest. So no, I wouldn't recommend it. But I think, a nice relaxing rooibos tea or something like that, or chamomile tea would be great with it.
Let's see what other questions we have. From our Instagram, we had someone ask, is vaginal steaming a purely spiritual practice, or are there evidence-based opinions about the physiological benefits? What is the research behind this? So yeah, we touched on that.
Are they able to hear us on Instagram?
Yes. Yeah, we have this crossing over to that space as well.
Great. Yeah, I think we touched on that, right?
We touched on that too. And then, yeah, someone was asking how to set up vaginal steaming to be in a comfortable, more relaxing position.
Yeah, that's hard, especially depending on the seat that you're using, can be challenging. Um, I think that it's just trying to get as much kind of padding on the seat for yourself. You know, and maybe that means you're only doing it for 15, 20 minutes versus, you know, longer. But I always like to have a nice environment. You know, if you need some support for your back, then maybe, you know, position it so you're up against the wall, so you can lean back if you need to. But I like to have some nice music. I like the room to be warm. And I like to have usually some essential oils in the background, and a meditation on, and just something that I can relax into with it.
Another position I found is I usually move around a lot while I'm doing this, because
Okay.
it's kind of hard to squat for 20, 30 minutes at a time. But even getting into child's pose where the bowl can kind of rest, it's hard to describe. I need a diagram for this one. But yeah, if you're in child's pose with the bowl kind of resting between your feet from like the back side, that can be a nice closing position, in my humble opinion, of vaginal steam.
I will trust you on that. I've never recommended it, so I don't have that feedback.
I'm getting another question on the screen here from Eva. Any advice from menopausal women?
I'm assuming that we're saying around using steam, and I think it's something that, you know, it depends on what the advice is for, right? Like what symptomology you're having during menopause. But assuming that there are issues vaginally, then yes, I would be absolutely using the steam for this.
Mm-hmm. Yeah, I think even your point earlier about the lining kind of losing its cushion or elasticity over time, that this would be a really great practice to kind of keep it moist, or just kind of activated in that way too. And probably,
yeah.
Are there certain herbs that are better for that life phase?
No,
you might have to go to the books for that one. But.
Yeah, I mean, there are. There's a whole. If I start naming Chinese herbs, I don't think anyone's going to know what they are. But that's where I would be using some of the Chinese herbs that I use frequently. Yeah.
It looks like that's all the questions I can find here in our Facebook comments.
I think someone just posted something on Facebook. Andrew did, about melting fibroids.
Oh yes, let me show.
And I'm happy to answer this question. You know, I've never seen anything like this where, you know, someone claims that they've just done steaming and their fibroids have completely disappeared because of it. It's one of the reasons why I said it earlier. When it comes to fibroids, you know, this is just a piece of everything else that we would do for a patient. And fibroids are not the easiest things to change. They don't just disappear or go away very quickly. It's a process. And so, do I think this can be beneficial for that with the right herbs? Yes. Do I think that, you know, on its own, it's going to melt fibroids? No.
And I guess too, even for like people that have surgeries to remove fibroids, or even just endometriosis, that steaming is a protocol afterwards to help prevent
and to heal the area. Yeah.
That would be a good time for that.
Absolutely.
We have another question too from DJ.
How long does it take to practice steaming before you see changes or improvements? I think it really just depends on what changes or improvements you're trying to see. Some things happen faster, some things happen slower. It also depends on how frequently you're doing it. I think most women that I've seen have always said that they've noticed some change with just one steam. Mm-hmm. Sometimes more discharge, which is not uncommon. Sometimes just a change in sensation or in the environment. Those things, but for those things to be longer lasting, then I do think it's got to be used regularly and repeatedly.
Oh, something also that I've just noticed on a more personal level was I think even with the menstrual cycle, you can experience some stagnation like towards the end or beginning of your period and maybe get a little bit more of brown coloration versus the kind of red, fresh blood, fresh release.
Mm-hmm.
So I think steaming really helps kind of make that a much kind of clearer, quicker passing. That's one way to put it.
Yeah.
So, any other questions? Oh, this is the IUD question again that we touched on. Can you steam if you have an IUD?
Yeah, I don't recommend it. We mentioned it earlier. I don't think that's the wisest thing to do. Yeah.
Yeah, I know some people that do this, but I personally don't have experience with IUDs, so I can't speak to that directly.
Yeah, I steer away from it.
I think it also has to do with the material of the IUD, because some of them are metallic, and even if you think about that from a purely like, I don't know, just material wise basis, like that would be heating up. So, you know.
Yeah, no, I agree completely.
Okay.
Excellent.
Yeah, I think that's our last question.
Awesome.
So thank you again, Marc. This was so great and super to talk to you live here. And for everyone watching, I highly recommend checking out Marc's YouTube channel, Fertility TV. There's just so much content there, and all of it is super great and such a wide spectrum of subjects that you touch on there. And any other spaces people should be checking out? Definitely, your fertility workshop is live now on marcsklar.com. Oh yeah, check him out. And of course, stay connected with us at Leiamoon on Facebook, Instagram, or mailing list. We're preparing for 2 very exciting and very much vaginal steaming related product launches later this year that we really can't wait to kind of get out there and link up with you on. So thanks again for tuning in, and have a great rest of your day.
Thank you. Bye, everyone.
Bye. Thanks, Marc. Really appreciate it.
You're welcome.
And yeah, we'll keep you posted. I think because this does record,
we can go live, just so you know.
Oh,